Good evening, everybody, and welcome to Chat with the Changemaker. On behalf of the University of Georgia College of Public Health Alumni Board, I'd like to welcome you this evening. My name is David Johnson. I'm a 1993 graduate at the University of Georgia in environmental health science, and I'm proud to be and honored to be moderating tonight. We need to take a moment to remember that diversity and inclusion is at the core of the work that we do to ensure health equity for all. We must remember that we are stronger together. The University of Georgia College of Public Health Alumni Board's mission is to unite a network of dedicated alumni to create programming and engagement opportunities for our community of alumni, students, and faculty to connect and show their commitment to the University of Georgia College of Public Health. Why don't we get started tonight by introducing the board members? And I will kick it over to Meredith Woodman, who is our chat buddy and monitor tonight. Why don't we start with our name, the position on the board, the degree and year you graduated from the University of Georgia, or any focus or specialty that you held, and your current career title. Are you there, Meredith? Sounds like Meredith might be having a little bit of technical difficulty, so we'll kick it over to our board president, Erica Parks.
Good evening, everyone. Thank you so much for joining us for our Chat with a Changemaker series. We're so happy to see you. I hope you all had a great holidays, got some great turkey, and had some relaxation with your family and friends. I graduated from Georgia in 2011 with my master's in public health. My concentration is health policy and management, and I am currently a vetpreneur. I am the CEO and founder of Camouflage Me Not. Thank you so much for joining us.
And Erica, let's kick it over to Kim, Vice President, and then each person kick it over to a next board member. Why don't we do it that way?
Sounds good. I'm Kim Metcalf. I am our Vice President. I have environmental health science degrees, bachelor's and master's, 94, 96. And I am the owner of Riverbend Environmental. We're an environmental consulting firm. And I'm just excited to be here for the 40 under 40 honoree. We're so excited. And I will try Meredith again. And if Meredith's still having difficulty, how about we go to Nicole? Meredith? All right, Nicole, why don't you hit it?
Oh, there she is. There she is.
Y'all, I'm still having issues with my background, but I'll get that up in a second. I'm still here. Hi, everyone. Meredith Woodman, graduated in 96, and I am executive secretary for the board. Very thankful to be here, thankful to be on the board, and wishing everyone a happy holidays. And I'm the director for portfolio and project execution here at Elevance Health, which used to be Anthem here in the private sector. And who's up next?
We'll kick it over to Nicole.
Oh, excellent. Thanks, Nicole.
Good evening. I'm Nicole Hancock. I graduated, 1998, health promotion and behavior. Worked for many years. I'm medically retired now, but worked for many years with Emory Winship Cancer Institute, as well as Maximus. You may be familiar with Maximus, healthcare consulting company. And I was the statewide director for corporate and community health. So I was instrumental in writing several programs to enroll Medicaid managed care patients. And I'm currently a baker and a part-time bus driver. I actually drove the bus when I was at the University of Georgia and continue to do it to this day. So it's kind of fun. I'm just joined this year. Me and David are new, and Fabrice, and thoroughly enjoying ourselves. Looking forward to hearing what you have to say. It's just good to be here, and welcome. Thank you. Let's see, Fabrice, I'm throwing it to you.
Thanks so much, Nicole. I'm so happy to be here tonight. My name is Fabrice Julian. I'm a board member, a new board member, and graduated with a minor in public health in 2013, and currently an assistant professor of health and wellness at UNC Asheville. I'm going to kick things over to Valerie.
Valerie may be muted here. So is that all of the board members that we have present tonight? I believe so. And if Valerie joins us, we'll have her introduce herself as well. So the Chat with the Changemaker series originated as the Black Alumni Connection series, and its purpose, it was launched in April of 2021 during National Public Health Week, commemorating the 60th anniversary of desegregation and honoring UGA public health changemakers of color. In August of this year, the board decided to have a name change to Chat with the Changemaker to align with our commitment to inclusiveness and eventual feature of other diverse public health changemakers. One programming note of change moving forward is that the chat series will be held quarterly instead of monthly. Tonight, we are honored to be joined by Subomi Adeyemo. Dr. Adeyemo is a U.S. public health officer, pharmacist, and epidemiologist at the Centers for Disease Control and Prevention. Dr. Adeyemo was the first student to complete the dual PharmD and Master of Public Health program at the University of Georgia, and has served as a Presidential Management Fellow and with the CDC's Epidemic Intelligence Service Fellowship. She's participated in domestic and global studies, investigations, and public health surveillance of infectious diseases, including deployments to support the COVID-19 and poliovirus response efforts. Welcome, Dr. Adeyemo. And it's okay if I call you Subomi, isn't it?
Yes, please do.
Great.
We're best friends.
We're best friends now. We've had, I can't tell you how much fun we've had preparing for tonight, and I hope you guys have enjoyed as much as I have preparing. So let's dive right in, Subomi. When we visited earlier this month, you said something about finding community at the University of Georgia that really resonated with me. You said, the University of Georgia can be as big or as small as you make it, and how finding community was so important to you. Belonging really does make all the difference in the world, doesn't it?
Yes.
Tell us more about your philosophy on that and what communities you found during your days at the university.
I would start by saying college is truly an opportunity for you to meet new people that may have a similar or different background than you do, or even similar or different interests. The important thing is to surround yourself with good people that will look out for you, check on you, that want to genuinely see you succeed. And I was very fortunate to find that community by getting involved in student organizations, including the African Student Union, which had the most amazing cultural night called African Night, which was full of great food, Nigerian jollof rice, dancing, plays, and fashion show, which I helped choreograph. I also found community through the Black Educational Support Team and the UGA Lewis Stokes Alliance for Minority Participation Research Program.
That's amazing. And we made plans to go to African Night. It's a spring, right?
Yes.
Spring. Mm-hmm. So we're going, if anybody else wants to join us, by the way. So not only are you a triple dog, you were the first person to complete, as we mentioned, the dual Doctor of Pharmacy and Master of Public Health programs. Now, at one point in this journey, you were fairly busy. We'll just say fairly busy. You were, let's see, enrolled in the MPH program full-time in Athens, working full-time in Atlanta as a pharmacist with Walmart, completing an internship with the University of Georgia Morgan County Extension Team Mays program, and completing an internship with the Centers for Disease Control and Prevention Center for Surveillance, Epidemiology, and Laboratory Services. First of all, thank you for making us feel lazy. How did you balance all of that and manage self-care?
It was truly the grace of God and just having supportive family, friends, a great supervisor, and just my desire to want to be a great public health professional. And of course, great organization skills got me through that time. I will admit that I am an overachiever by nature, but the 2 internships that was self-imposed, only because I was selected for CDC's internship 2 weeks after I had already accepted Team May's internship. And at the same time, I couldn't say no to CDC's, and Team May's was also an amazing internship. So the only solution for me was to do both, and no regrets.
Did you ever ask yourself, why did I do this? Why did I agree to do all this? In a car ride from Athens to Atlanta, or, you get that windshield time and you think, was this the best decision? Any regrets?
No regrets, but I definitely did ask myself that question. But then my circle, my community would always encourage me to say, hey, you got this. We see that you're working hard. It's going to pay off. So that always helped. But I definitely did ask myself those questions.
Well, let's pause for just a second. We want to try to keep up with any questions that our attendees might have tonight so that we don't get too far off topic. So we want to check in with Meredith and see if we have any questions. I think you're on mute, Meredith.
Thank you. At least you can see me talking. Well, first of all, what a wonderful smile and awesome energy of this conversation tonight. We are having some great love on the chat here. We have some questions. Subomi, do you have a LinkedIn that you could share with us that you might be able to put and share with us on the chat, or you can provide to me and I can give to the team here?
So my disclaimer is I don't have a LinkedIn. I know I should have one and I'm working on it. It's on my to-do list.
Okay.
So I will get to it. So hopefully by the beginning of next year, that's my goal, to have that LinkedIn page. But I do realize the power of LinkedIn, so I will get on that.
Excellent. And then from everybody else, just everyone's stating how impressive you are and what an inspiration you are. So
Yeah.
just, we definitely will stay in touch with you, and we'll definitely make sure that you're on that LinkedIn, because we're going to want to highlight you. You've actually missed a lot of the items that we've put out there highlighting. So we'll make sure we keep up with you. Thank you. Awesome.
Thanks, Meredith. Subomi, through your work as a Presidential Management Fellow with the Division of Global HIV and TB, and as a part of the President's Emergency Plan for AIDS Relief Program, you were involved in the management of the supply chain of HIV and TB commodities to Kenya, Uganda, and Cameroon. Tell us more about that work, and really, what did you see as some of the major barriers to getting those commodities to the folks that really needed them?
So the President's Emergency Plans for AIDS Relief, which we often just call PEPFAR, was launched in 2003 as an emergency response to the rapid spread of HIV. The goal was by 2030, 95% of people that are HIV positive will know their status. 95% of those individuals will be on treatment, and then 95% of those individuals will be virally suppressed. So through the generosity of the American people, over 21 million lives have been saved, millions of infections have been prevented, and over 50 countries have been impacted. It's truly just a great program in general. And I will say that when I go to these countries, and yes, the US does a lot for countries when it comes to food aid, but when you actually talk to the people there, they're so grateful that family members that wouldn't have lived 10 or 15 or even 5 years ago are now living to be in their 80s and 90s because they have access to these life-saving HIV medications. So from my end, I was fortunate that I had a branch chief that wanted me to find a way to incorporate my pharmacy and public health background by getting me involved in the supply chain of HIV and TB commodities. My specific role was to work with ministries of health and global partners, and also our interagency colleagues, to ensure that individuals at the healthcare facility level receive their medications. In regards to challenges, you always want to ensure that you're working to improve systems, whether it has to do with forecasting, procurement, or what we call last mile delivery, which is actually getting the medication to the hands of the patient. So just working through those different challenges as they come, working with different partners has truly been a wonderful experience.
So really looking at it from a systems approach, how can we improve the system of the delivery, the system of the supply chain? Okay.
Exactly.
Great. Now, as a fellow through the Epidemic Intelligence Service with the Division of Parasitic Diseases and Malaria, you were involved in both domestic and international deployments. In fact, when we first connected, you were on a polio deployment to Zimbabwe. Can you share with us a little bit about that particular global work?
Yes, I want to start by saying that it's truly a privilege to be able to work on improving public health, both domestically and globally, alongside my amazing colleagues, mentors, and supervisors at CDC that are truly hardworking and just committed to putting in the time, the knowledge, the resources needed to prepare for, respond to, recover, predict, and just respond to any domestic or global public health threat that comes on. And with that, that does involve deploying several times for different responses. So I myself deployed several times domestically and internationally for the COVID-19 response, working on their various aspects of the response, whether it has to do with studies related to self-testing or monitoring of possible suspected adverse events, and also for the polio response. So when we last talked, I was that was my second time going to Zimbabwe to help with their polio immunization campaign, and it was a 7-hour difference. But thanks to technology, we can connect with each other wherever we are. And currently I do work with parasitic diseases. So I do investigations related to parasitic diseases, whether it's organ transplant related, and just really just get to be a service to my country, which is truly a blessing.
I just realized that I was probably talking to you at like 4 o'clock in the morning. So thank you for taking my call anyway.
No problem.
Let's check in with Meredith and see if we've got any questions in the chat box.
Thanks so much, David. Yeah, we sure do. Dr. Feldman was able to join us. Hi, Dr. Feldman. Thank you for joining. We've got some other people that were able to join as well. Subomi, can you comment on the value of having both PharmD and your MPH degrees? And also just wanted to highlight something that Erica mentioned. I was going to mention it also, mentioning about AIDS and the research that you've done and all that you were able to do about World AIDS Day being on, coming up on December 1st. So World AIDS Day. But can you discuss your having both your PharmD and your MPH degrees and the value of having both, please?
I would say that it's truly priceless. When people think about the traditional role of pharmacists, they don't necessarily think about pharmacists working in public health. Even with myself, I had to go out there and really research what ways can I use my pharmacy and public health background to really impact population health. So by having the drug knowledge and having the just the therapy knowledge, and then also having a public health aspect when it comes to epidemiology and pattern of diseases, I'm really able to work in different sectors of public health, whether it has to do with HIV, whether it's polio, whether it's parasitic diseases. Both degrees can truly complement public health in general. And one thing that I always tell people, or people kind of ask me, is that, hey, you left, the private sector just does pay more. That's a disclaimer. So people are always like, hey, you left a higher paying job to go work in the public sector. Why for the federal government? Why'd you do that? And what I tell them is that if I would have stayed in my little bubble at Walmart, I wouldn't have gotten to, number one, impact population health. I wouldn't have gotten to go to Kenya 3 times, Uganda 8 times, Cameroon, South Africa, Zimbabwe. I wouldn't have got to meet with ministries of health and just really have a chance to see change in real time. So just number one, getting out of your comfort zone and just thinking, how can I use my degree to best have impact is truly a blessing.
That's awesome. Meredith, any more questions?
Yeah, they're coming in pretty quickly now. Let's see. How has mentorship played a role in your success, Subomi?
Mentorship is just priceless. I'm really fortunate that I have several great mentors, some at CDC, some outside of CDC. And one thing I always tell people is when you're looking for a mentor, just find somebody that has a desire to see you succeed and just strive to make them proud of you, and somebody that's going to be open and honest with you and give you feedback. You might not agree with what they're saying, but at the same time, just be open to understanding their perspective. And you always want somebody that's more seasoned than you, and then just in different sectors. So even though I'm a pharmacist and a public health professional by training, I had a mentor through the Young Government Leaders. It was actually a senior executive leader in the IRS. And people were like, oh, like IRS, what does that have to do with public health and pharmacy? But what I will say is that just her wisdom and knowledge and her investment in me, when I was preparing to apply for the Epidemic Intelligence Service, as busy as she is, she took out 2 weekends of her time to just do practice Zoom interviews with me. So I was just really just appreciative of that. So when I finally got into the program, I was able to go back to her and say, hey, mentor, like all that time and effort that you put into giving me feedback is worth it. I'm now a disease detective. I'm an Epidemic Intelligence Service officer. So definitely find yourself great mentors and have multiple mentors.
Awesome. We have one more, but I don't want to interrupt your questions, David. I can hold until there's the next break if you'd like.
Well, let's go ahead. Let's hit it, and we'll clear them all out, and we'll keep going. How does that sound?
Yes, sir. All right. Valerie asked, can you expand upon the last mile health concept? It's an important, it is such an important component of health delivery, if I can get that out.
Yes, so with last mile, what's challenging in a lot of public health systems is that you have your national level, the regional level, the district level, and then you have your health facility level. So specifically for me, when it comes to supply chain, what we're finding is that at the national or district level, there might be enough of the medication in country. But for some reason, people at the facility level, the people that are actually using the medication, they're not getting it. So it could be a transportation issue, it could be a communication issue, it could be a transparency issue. So just really looking at the system and seeing where the failure is to actually get that person that's actually going to take the medication, get it to them to make sure they don't have any gaps in care is truly what last mile is about. And sometimes it might take having people on motorcycles or boats to go deliver the medication, just depending on the different countries that you work in. So just really understanding that that is the goal. Like, yes, we do have different funders that come in and provide these medications or access to these medications, but at the end of the day, we need to make sure that the person that actually needs the medication is reaching them.
So important, that last mile. Subomi, in addition to your important global work, you really do remain passionate about your community work as well. It kind of reminds me of that bumper sticker, think globally, act locally, except you act both globally and locally. So thank you for your passion around both. As part of that, you co-founded an outreach program focused on elementary students, particularly their self-monitoring of health, preventative care, medication safety, and higher education in STEM. Some of this work involved education in outcomes of high-risk health behaviors. Can you tell us more about that? And really, what strategies did you employ or utilize that you felt really got your message across to those? Because sometimes they can be a tough audience and not everything resonates with them. So anything that you thought was particularly, extremely helpful in getting that message across?
Yeah, I would, first of all, I have to give a huge shout out to my friend and co-founder of the outreach program called Project Seed, Changemaker. We created this program during our second year of pharmacy school. And the real reason was just to allow students to see in real time how math and science that they're learning in school is used in pharmacy and public health. So for example, one of the activities that we usually do with the children is give them a mock prescription where they have to use math to calculate how much of an ingredient is used to compound a product such as a cream, lotion, or chapstick. And then we also teach them about medication safety, just depending on whether it's pre-K or kindergarten versus like 3rd or 4th grade. And we'll have a medication bowl package and they have to identify whether this is a medicine or whether it's a candy, just to let them know that sometimes you can't tell the difference. So it's best not to take something that you find because you really don't know what it is. And I've truly just enjoyed meeting the students. These students are smart. Like they tell me about their medication. I'm like, wow, you guys are giving some good counseling points. So it's been great to interact with them.
That's fantastic. And about, in your estimation, how many teens has the program reached? Any idea?
So I know 1 year, I'm not sure about this year, but I know pre-pandemic, so that would have to be 2019. We reached maybe 234 that year. I haven't been keeping up with the recent numbers yet post-pandemic. So we try to fit it in with our schedules as much as possible.
Great. Very important. Thank you so much for that. So many times we talk about the point in our public health journey when someone took a chance on us. You talked a little bit about mentorship and how important that was to you. Can you share with us at what point was that chance taken on you and by whom? Who took a chance on you?
That's a powerful question. The first person that comes to mind is Connie Ward Cameroon, who was my supervisor for my CDC internship that I did during my MPH program at UGA. And just as a little bit of the backstory, when I decided to do the MPH degree at UGA, CDC was my ultimate goal. It was my 5-year plan for after I complete the MPH degree, one day I'm going to end up at CDC, impact population health. Therefore, when I did get selected to do the internship during my MPH program, it was really motivation and confirmation for me that I made the right decision to give up the opportunity to complete a pharmacy residency to instead finish the MPH program. Then I also do want to shout out Jennifer Lind. So she was a CDC pharmacist that just always, that I met through one of my friends, Raven Speltz, who also did the MPH PharmD program with me. And she always made time to just talk to me as somebody that wanted to kind of be in her shoes one day. Even though she didn't know anything about me, she always took the time to speak to students. And that's one of the things that I do now at CDC. I always take the time to speak with students. So every month I have a seminar with students at FDA, CDC, and OPM, where I tell them about my journey, about different internships in public health, just to really motivate them and get them thinking outside the box.
Awesome. Paying it forward, right?
Definitely, you have to.
Great. Let's check in with Meredith and see if we have any questions in the chat room.
How did you know, David? All right, so we got one right after, and let's see. Let me just open this up. Okay. Sorry, I've got my computer and my phone so that I'm able to see everything. Bear with me a second. Let's see if y'all are still able to see me, hopefully. How do you feel that UGA prepared you for where you are today? I think you spoke to some of this, Subomi, for sure. And what were some of the resources and networks that were provided that you found especially useful?
First of all, I would say that I actually found out about the Epidemic Intelligence Service, which I'm currently doing while I was doing my MPH program. So as part of the MPH requirement, you're required to do the 1-hour seminar where different speakers come in. So there was an Epidemic Intelligence Service officer that came to the class and told us what EIS was. And I was like, wow, this is amazing. I want to do this one day. So the fact that from that room, hearing that person speak to me, actually following through with it, and now I can say that I'm an Epidemic Intelligence Service officer is just truly wonderful. Then also the coursework, that's of course, you have to have that strong foundation, and the way that the curriculum was with the epidemiology program and just having the opportunity to kind of do some biostatistics as well, health policy, et cetera, definitely prepare me to have that foundation that I can build upon in any setting, not just in public health, but any setting, I can always use that foundation.
That's so cool. I'm doing that seminar tomorrow, by the way.
Nice.
I was about to
Really
ask.
looking forward to it.
Good for you. Okay, and I would have bet money on this if somebody was going to ask this. If not, I was going to ask this as a follow-up for others. Subomi, the next question was, right as soon as you finish this, would you be able to mentor if somebody wants to follow the same path that you have taken? Would you be able to guide / mentor them as well? I know you just stated that you give monthly talks, but if somebody wanted to reach to you, are you open to that? What would somebody? How would you like them to approach you? Let's start.
Sure. I'm definitely open to it. I know the school has a formal mentor program, so I don't know if it's better to go through that just for easier communication, or we can just do it through regular email and just set up just monthly check-ins or quarterly check-ins, but definitely open to always paying it forward. And if you want to join my current sessions that I have monthly as well, definitely feel free to do so.
We'd love to get that information from you to distribute to the audience here in case there's interest to join. So thank you so much. Any more, Meredith, or was that the last?
That's the last one so far. I'm sure more will come. And if David, if that's okay, I was raising my hand just so I wasn't interrupting, but, and then Lindsay did put out there the link for the mentor.uga.edu. And then, yeah, offline, we can always get that from Subomi and provide to everybody when she's speaking, etc. But we're good so far. We're all caught up.
Great.
Thank you.
Awesome. Keep those questions coming.
Absolutely.
Subomi, congratulations on being recognized as one of the University of Georgia's 40 under 40. what an honor, right? Thank you so much and congratulations. What was that experience like for you? And just, can you sort of capture in words what that meant to you as a young professional?
It was, like you said, it was such an honor. It was an exciting moment to be recognized by the university. I was grateful. I felt so much love from the university and also from my family and friends. And I just definitely want to say that the 40 under 40 team does an excellent job of making you feel appreciated and like you're a mini celebrity, which I am grateful for. Just because being in public health, you don't really think about being recognized for your work. So it definitely felt good to just pause from being on go, go, go to kind of receive my flowers. So I'm truly am grateful for that.
Appreciation and recognition so much, it just adds so much fuel to your fire, right? Especially when you're a high achiever like yourself. So we'll continue to expect great things from you, Subomi.
Thank you.
You truly are an inspiration, I know, to me and to many of our participants tonight. From a public health perspective, I feel like you've really seen so much and accomplished so much, and yet there's still so much work to be done in public health. And I know, like I said, that we can expect many more great things from you. What's next for you? What's sort of on your career bucket list? What do you see on the horizon?
Let's see. I guess before I stated that initially I joined CDC in 2017, and that was my 5-year goal. So the fact that I was able to do it in 2 years, it kind of left me, that was the major thing on my bucket list. So as for right now, I would say that I am a lifelong learner. My goal is to gain the knowledge, experience that I need just to be the best public health professional that I can be in any diverse setting and just serve as a resource to those around me. Therefore, I am always open to new opportunities to grow and inspire and just mentor the next generation of public health professionals. So no bucket list for right now, but I am definitely just open to just becoming a better health professional.
So nothing on the bucket list, huh?
Nothing on the bucket list.
Okay, I take that to mean you're really enjoying what you're doing now. So I think that that's great because there's so much work to be done.
Exactly. My to-do list is always growing.
Excellent, excellent. Meredith, we got anything in the chat box?
I think the only thing we have right now is just lots of praise, lots of congratulations on all that you've done. Congratulations on well-deserved honor. Welcome to 40 Honoree Club. One item that was raised is how will we receive information to be shared if we're not current students or alumni? Erica, how do you want us to handle that?
I just inboxed that person and told her to send me her email, Akila, and anyone else, and private message me so I can make sure I be on the lookout for that and get you all the information. Thank you.
Thanks, Erica.
Thank you, Erica. All right, keep those questions coming. So, I see a couple of younger folks here. So in students, what piece of advice, thinking about, to your triple dog days at the University of Georgia. So what piece of advice would you give to students going through college right now?
Number one, don't limit yourself or place yourself in a box when it comes to your career, and just be open to trying new opportunities, and always make sure to find time to share the knowledge that you acquire with those around you and just really inspire the next generation that's coming after you. And I guess one last thing that I think is really important is to don't give into imposter syndrome. Just because you might see somebody that's doing amazing things, that doesn't mean that you can't do amazing things. Like, we are all intelligent people, just has to put in the work to get to where we want to. So don't ever think that somebody is necessarily better than you. I'm not better than anybody. The only difference is that we just, just put in work in just the different sectors that we work in. So always just value yourself and just know that sky's the limit.
Great. That's awesome advice. Be yourself. Don't try to be
Definitely.
anybody else, right?
Exactly.
I love David, we do have 2 more questions that popped up.
Great.
One is a direct question to Subomi, asking her if she's going to be joining the mentor program here at UGA.
I will, yes.
No pressure.
No pressure.
Ask. If not, yes, absolutely. Okay, wonderful. And then let's see. The next one is with how vast public health is, how did you know that your path was fit for you? There are so many pathways. So what advice would you give someone who is interested with many disciplines like health policy, epidemiology, etc.? How do they decide where to go and what paths to take?
I would definitely say it's more of a stepping out on faith. Was I 100% sure that my path would lead to where I am today? No, I wasn't sure. Was I 100% sure that epidemiology was the best thing to major in? I wasn't sure. But at the end of the day, I chose epidemiology just because at the time, that's what I was more interested in. But in public health, whether you have an epidemiology or a health policy background, one of the great things about MPH programs is that you get a taste of each kind of discipline a little bit. And a lot of federal jobs, this is my personal opinion, so disclaimer that all the views are of my own and not any organization. But personally, I feel like a lot of federal jobs require on-the-job learning. So you're not expected to know everything on day one. So if you have an epidemiology background, you can always learn policy. If you have a policy background, you can always learn epidemiology. And it is one of the great things about CDC in general is that because we work across so many disease states and so many disciplines, there's always opportunities for you to volunteer for a different response and learn a new skill.
That's awesome. We try to, during these chats, bring out mechanisms or ways that students can find out about things. So there was a couple of times in our discussion on the 2nd of November earlier this month that you talked about at one point not knowing that there was let's say funding available to do research. That was part of your undergraduate program, correct?
Yes. Yeah. So
tell us a little bit about that.
Sure. So with that, one of the great things about UGA being a great institution is that there are a lot of resources out there, but through community, I was only able to find out about these resources. I would go to meetings, so such as a meeting that we're having now, and I'll hear somebody speak about a program, and then I would go ahead and research the program, like, hey, what's up with this program? So that's how I found out about the research program, Peach-Stokes-Lewis-Stokes Alliance. And through that program, I got to do undergraduate research at the university in the ecology/entomology department. And one of the hilarious stories that I will talk about is one time at the Okefenokee Swamp, I was doing research with a graduate student, Sarah. Her last name is now Bowman. She has 2 beautiful boys now. And we went to the Okefenokee Swamp to collect the microinvertebrates. So I overall like to dress nice, but I was in the gator suits and walking in swamp water with alligators there. And I remember Sarah telling me that, hey, look at this tree. If something happens to me, I need you to use this GPS to get back to the boat. And I'm thinking, like, all of these trees look the same. If something happens to you, like, we are so screwed. And then on the way back, our motor broke. So literally I canoed a boat for 9 miles. It was a great experience looking back. Would I do it again? No, but it was great undergraduate experience. And I have pictures to prove that I actually did it, because some people that know me now would not think that I would do that. But definitely a great opportunity that the University of Georgia provided for me. And through that, you also got, it was a paid research experience. So you got a little stipend to also gain the skills, which was wonderful.
And students are always looking for ways to earn money. That's what it was the stipend, not that there was funding for research. So thank you for that. I always enjoy it. I like to have fun and learn at the same time. So these moments of levity, I really enjoyed that story about being possibly stranded in the Okefenokee Swamp. That was great. Had a great laugh over that. One of the other sort of tidbits of information was how you found out about the dual PharmD and Master of Public Health program at the university. Can you tell us a little bit about that?
Yes, it was actually one of our teachers from the pharmacy school came and spoke to our class and say, hey, we're doing this program with the College of Public Health. It'll give you a chance to do your pharmacy degree and in addition, gain a public health degree. You will have to, of course, do your regular pharmacy work and take on additional classes, but it's going to be one tuition. So when she said that, I was like, one tuition? and I also get to gain public health skills, which I am interested in. It was a no-brainer for me. So I was just literally like, where do I sign up at? And it definitely did require, pharmacy is already hard and MPH is hard as well. So it definitely did require me taking sometimes the 7 o'clock classes or the 6 o'clock classes in the evenings, and also some summer courses just to kind of keep up with both programs. And then of course, once I was done with the PharmD requirements, I still had the MPH programs left, which led to that hard time, not hard, that's defining time in my life when I was super busy working and then finishing up the MPH program. But I definitely am grateful for it. And I'm just truly honored just to be a triple dog and just have so much love for the University of Georgia.
That's awesome. That's awesome. I love the way you learn about all of these opportunities, you know, the folks that make the time to spread that information, and the availability and the opportunity is so great. So taking advantage of all of those that are offered to you is really a good thing to do. Meredith, we're just checking in with you on the chat box.
Yes, I was like, well, one, it's just impressive on everything. And I know you said, I love that you just said that about the imposter syndrome. And I wanted to back up on that for a second. A lot of people don't speak about that. And it's a real thing. And a lot of people, regardless of your age, it's a real thing. And so I just think that's a wonderful thing to say. And you're super impressive, but all of us, no matter what stage in your life, I want to continue to learn. If I'm not learning, I'm in the wrong space. I mean, I always want to learn and grow, and I always want to be surrounded by people that I want to learn from. And so I think that's a wonderful thing. So thank you for stating that. So, okay. So lots of love coming from everybody on the chat here. Okay. So, we've got some people saying they're thinking of getting, moving more towards MPH, MD. Do you have any insight on that? Have you encountered any coworkers, et cetera, that have worked with who have had that type of background in the CDC, specifically MPH, MD, regarding that?
That is very common for a lot of physicians that are at CDC to have the dual degree. Some or most of them, I believe they finish the MD requirements and then do get the MPH either while they're working at CDC or sometime during their private practice and then come over to CDC. So it's there are dual programs out there. I don't think there's that many that have the MD, MPH, or maybe it's becoming more popular now, but it's always okay to get the MPH first. And it's in reverse as well. So I know people that are at CDC, they had their MPH, but now they're doing medical school as well. And then their goal is after medical school to come back to public health. So it just really depends on your own path. It can always change. You can start off in one place and then decide to kind of change things around. So it's definitely something great to consider.
Excellent. Thank you so much. I've got another question from Ms. Kim Metcalf, our Vice President. What is your favorite UGA memory?
Ooh, that's a tough one. So many years.
Okay,
so
not your favorite, because we don't want to limit it. One of your favorites. Let's start with that.
Okay. So disclaimer, I was at UGA for 9 years straight total. So that's a lot of memories. Yeah.
You should have a few.
Yeah. So besides the Okefenokee Swamp, because that's very memorable, I guess another one would definitely have to be the African Nights, just because so much goes into that performance, from rehearsing at Memorial Hall and sometimes Ransby after classes, and just bonding with people over practicing a dance routine and even choreographing a show, and then seeing the final product where you even have people from other schools or other states come to UGA to see our African Night program was just truly memorable.
That's awesome. Okay. I think we're caught up. Just lots, like I said, when you get a chance, you can look at the chat. Just lots of love for you.
Thank you guys. Thank you.
Lots of praise for you. Also, I just want to shout out with all the young folks that are on the call. People saying how much they're learning from the session, and it's also really impressive that not only did you see the opportunities, not only did you see them and seek them, but you followed up and did them, and actively did them and performed them and continue to move. A lot of people don't do that. They see them and get stuck. How did you do that so seamlessly, or it seems seamless to us? How did you do that?
I think for me, just like you guys have come up to this discussion today, just to kind of learn about something different. going to those different seminars and just really hearing something that you might not be 100% interested in, but it sounds like something you can see yourself doing, and just write it down and say, hey, I'm gonna take 10, 15 minutes to look into this. And if it seems interesting to me, I'm gonna look into it some more. And that's definitely what I do. Like, even being as busy as I am, I might attend a seminar, I'll see something interesting, write it down. I might not get to it that day, but I make sure that at least within a week, I follow up on it just to see if that's something that I should kind of put in my forefront that I'm gonna work on or work towards. And even if it's not for me, I share with other people. So when I hear about different internship opportunities, whether it's at CDC or even for high school students, I know it might not apply to me, but I definitely make sure that I pass that knowledge on to somebody else. And hopefully they follow up on it, but at least I did my part as far as sharing the knowledge.
So it goes back to what you said earlier about your to-do list always being so big, but you also, it's you sharing, it's you actively working, moving it forward and paying it forward. Excellent. Thank you.
Exactly.
Okay. One other one came in, David. Can I ask this question, or do we need to keep
Go
moving?
right ahead. Yep.
Would you share an experience where you felt proud of your work, thinking about your recent impactful and meaningful work?
Oh, wow. I guess my aha moment where I would say that I was walking in my purpose, which I consider work impacting population health, was when I was in a meeting with in Uganda with members of the Ministry of Health, members from United States Agency for International Development, and some other just global partners. We were revising the pediatric HIV treatment guidelines. So basically, whatever we decided in that room that day would impact the health of a whole country. So that was kind of a surreal moment for me that, like, you are really impacting population health.
That's incredible. Yeah, that had to be surreal, and just you knew you belonged there.
Exactly.
I had this conversation in preparation for tonight, when we were at the State of Public Health, when we listened to Montrese speak, and knowing that we belonged and having that sense of community, and knowing that we all belong here, but our purpose is to serve a greater good. And that's just fantastic. That's wonderful. Awesome.
Thank you.
Great. David, there's another one. This is great. And so many people are asking questions. I'm so excited. I'm so proud of
That's
everybody.
great. Keep them coming.
All right. Awesome. How often are CPH chats? Oh, okay. This is more process. How often are the CPH chats? I really appreciate the session. I would like to be part of more in the future. So David mentioned that. Do you want to take that, David?
Sure. So up until this point, from the moment these were started, as we mentioned earlier, till now, they've been monthly. And recently we made the decision to hold these quarterly. So Erica's going to pick up with some announcements here in a few minutes as we close out. But the next one, we're going to go to a more quarterly cadence from now on. So watch for that. Erica may have some more information as she closes us out, but I'm looking, and we have about 9 minutes left until the top of the hour. And I want to give our guest the chance for any closing remarks. But before you do that, I just want to recognize you and thank you. You are such an inspiration to all of us, and taking the time out of your schedule, not knowing even where you might be. Look where we originated this conversation. And thank you so much. You are such a fantastic ambassador for the College of Public Health, and for the pharmacy program, and for the university, and for our profession. So thank you for that.
Thank you, guys.
Continue the great work, and thank you for being here. Any closing remarks that you want to leave us with?
Yes, I definitely just want to continue to encourage everybody on here. You all are doing, even the board, you guys are doing amazing things in your fields. And I know that sometimes it's not easy, but the fact that you guys are just pressing forward, and that you guys do find time to still engage with students at the university is amazing. And to the students, please take advantage of the resources that the university provides for you. There's so many things out there, and you might wonder why somebody's doing better than you. It's because they're taking advantage of these resources and the opportunities that they have out there, and just following up on them. So I definitely, again, want to just thank you for the opportunity to just speak about my journey and just share my passion with you all. And I truly just look forward to continuing to support the public health program as best as I can.
Thank you so much. Amazing. And I look forward to African Nights with you.
Yes.
So
Me
we've
too.
got a date. We've got a
Awesome.
date.
I
Thank
wanna
you so
go.
much, Subomi. So with that, what I'd like to do at this point is kick it over to our board president, Erica Parks. She has some announcements for us.
Thank you so much. This was amazing tonight. I really love the flow of this talk. We actually started the flow of this layout for this chat 2 months now. And so David and I put together this layout and we really like how it's going. I love the engagement. I'm so happy that we have folks here that are students as well as non-UGA affiliate. That makes us feel really great and glad the word is getting out. I want to shout out to Dr. Feldman for being here with us. You're always coming. You're always walking beside us. We appreciate you. I know we say it all the time, but we want you to know that we can't thank you enough for your commitment to this board. We appreciate your feedback and for always being present with us. I want to also shout out, I'm sorry, I went so fast.
No,
Go ahead,
thank you.
sir.
Thank you. It's really been a great program.
Thank you, Dr. Feldman.
You're welcome. I want to also shout out Lanisha, our former board member for joining us tonight. She has, this is her first time being with us since she left the board back in July. And I also want to give a special shout out, she doesn't know this, to Akila. I hope I'm saying your name right. I got your email. Thank you for your interest. Hopefully we'll see you as a future dog. I saw that. And so I'm very excited that you're interested in what we're doing here at UGA and thinking about coming here to get a PhD. That is so awesome. But to all of you students that are here, spread the word. Spread the word and encourage more students to come, whether they are a UGA student or not. As you see tonight, you don't have to be a UGA student or staff member or board member. Come and get the information. It's free. This knowledge, this information is what you need. What we all heard loud and clear tonight was food for thought for all of us. Two things I heard that were just like music to my ears is purpose, moving and walking and operating your purpose and being intentional. You don't end up in any of the seats tonight that you see without some intentionality. So as you're moving about and going towards your goals, make sure that you're intentional and don't let the imposter syndrome get you.
Be authentic, right?
Yes, be authentic. I also want to share with you tonight, today is Giving Tuesday. Now, if you are affiliated with UGA, you know we do our Giving Tuesday at the beginning of the year. And so this is not our annual Giving Tuesday, but this is a worldwide Giving Tuesday. So we're not going to miss out on the opportunity to give back to the College of Public Health. And so tonight, I know we have 25 people here. You may have given earlier to some other organizations, but I'm going to pull on you tonight and I'm going to ask you for a donation of $20. If all of us give $20 tonight, we will have $500 from this Chat with a Changemaker series. How awesome would that be? That in 1 hour setting, we collectively pulled in $500. Now, I know you're probably saying, well, where is this going? Because I gave to something earlier today. Well, this is going into our future. We are feeding the future. We are planning the future. We're sowing in the future. The future is our students. And so with this $20 you're going to give tonight, it's going to go to our College of Public Health food bank. And so I'm going to read you a little bit about this food bank. This food bank pantry that we have, it provides support to our students, non-perishable and frozen food and other items for our students that may be struggling with not having enough to eat or nutritious foods to eat. You all know, we all have been students, and we know how it's like to be hungry. Even if you've never been really hungry like that, you know what it feels like when your stomach starts growling, right? And if you can't satisfy that need, that's a problem. Can't focus, you can't study for your exams, and you don't really feel really good about yourself. And so we want our students to feel really good about themselves. We don't want there to be any barriers or blockages for them to pursue their education because they are our future. They're our future public health practitioners. So Lindsay is going to put the link in the drop box. She may have already done it. I want you to copy and paste that link. Go right now, copy and paste that link. Go right now, copy and paste that link. Go ahead. Copy and paste that link, put in another screen so that you don't leave us. And I want you to give that $20. So when we leave here tonight, we know that we collectively on this chat contributed $500 to this food pantry. So the last thing I want to say is, as David mentioned, we're moving our Chat with Changemaker series to quarterly. So if you signed up tonight, we have your email. That is so wonderful. You'll be added to our distribution list. And so you'll know about when that next Chat with Changemaker series is going to be. We're going to take a pause to look at our data from starting this almost 2 years ago, find some things and look at how we can better market this for our audience, because we're starting to build up a lot of momentum and we want to really take advantage of that. So we're not pausing because we don't want to provide it for you. We're only pausing to make it better for you. So we thank you for your comments. Some of your comments you may be seeing because I've asked that we capture this particular thread, and so that we can use it to market, to encourage people to come and let them see what you're getting out of spending an hour with us. And so we have 2 minutes left. I don't want to take up any more of your time. So I'm going to yield and ask Dr. Feldman or Lindsay if they had anything they want to add, or even Kim as well.
I just want to continue to say thank you. This was just wonderful. And thank you all for being here and your engagement. I lead the Office of Development and Alumni Relations, and things like this just make me so happy to be where I am and to be leading these incredible alumni and their endeavors. So thank you again.
Yeah, it was a really, really good program. I'm a real believer in the value of the 2 degrees that you have. And I do want to talk to you later about being involved with the pharmacy section of the American Public Health Association. So we'll talk to you soon.
Thanks, everybody. Have a safe night. Take care.
Thank you.